Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
All right. We would like to thank Dr. Appelbaum for coming and joining us on the Dr. Yan Memorial Lecture today. This was an amazing lecture, but one of our characters of U of L here that we do a Cardinal Minute, where we ask you, if it's possible, to give us just in 1 minute a moment of thoughts about your presentation today in a small summary.
In 1 minute, okay.
Yeah, 1 minute.
Well, Don Thomas had this idea that you could replace an abnormal bone marrow with a normal bone marrow, and it took him, decades to make it work. But today, over 100,000 people every year get a marrow transplant for diseases of the marrow. But not only that, marrow transplantation was the first form of immune therapy that was shown capable of eradicating a disseminated malignancy. And today, over half of patients with metastatic disease get some form of immune therapy. Marrow transplantation also really was the origin of gene therapy, where we can now take out someone's own bone marrow, fix it, and put it back. And beyond, so there's transplantation for its own sake, there's transplantation as the father of immunotherapy, there's transplantation as the nidus for the development of gene therapy, as well as the development of now solid organ transplantation. So Don's legacy is just really incredible, and I think it's just going to continue to grow.
Amazing. It was a pleasure and honor having you with us today, Dr. Appelbaum.
It was my pleasure being here.
Thank you.
Thanks, man.